Ectropion is a condition when the eyelid turns outward. This leads to exposure of the inner mucosal surface, leading to symptoms of tearing, dryness, irritation, and light sensitivity. Facial paralysis can lead to ectropion due to muscle paralysis around the eye. Treatment of this condition is accomplished by tightening the eyelid by reducing its length overall, usually by a surgical technique known as lateral tarsal strip. After the initial incision is made, dissection is carried down to the orbital rim bone. The next step is to expose the lateral tarsal plate. A mucosal cut is first made to free the lateral tarsal plate inferiorly. A superior skin cut is made after the tarsal plate is freed from the overlying orbicularis muscle. The tarsal plate is then completely denuded. An appropriate amount of the tarsal plate end is excised. A suture is then passed through the new lateral aspect of the tarsal plate before it is anchored to the orbital bone rim. The eyelid rim is then sutured back together before the skin is closed.